do that.
We're here with the Arlington United Methodist medical team that just came back from from Caranavi, where they had a medical project there, and I just wanted to ask them a little bit of questions about not so much about their experience, but more on the significance of using the mobile dental clinic, which I know was out there with you. You did have the mobile dental clinic this week, didn't you?
Oh, it was amazing to have them with us. They worked so hard, harder than us, to take care of these people. They wouldn't come to dinner. They just worked right through, and they were such a joy to be around. They had such pleasant attitudes. I've never seen anything like that mobile dental unit. It was just an amazing thought to be able to take that to a place far away and help those people and come on home was just beautiful.
And for us to be able to work alongside Bolivians was really special. We've gone on other medical missions before, but we've never worked alongside any medical professionals that were local. So to have Dr. Luz and Patricia and Pamela, the two dentists with us working alongside was wonderful. Gave us a chance to get to know them and also to question them, because we have a lot of questions. We don't have the same type of culture as well as medical problems, so to be able to talk with them was wonderful.
We really want to thank your foundation for providing not only their salaries, but for providing the van. We really have had a wonderful experience because of that partnership, and we've also really gotten to know the local Bolivian culture because they shared with us. We had one experience in the past where we had dentists that came with us, set up their equipment, and were part of our clinic. And they worked very hard also. But to have the mobile clinic and have them working in tandem with us allowed us really to keep a more organized approach. We saw a lot more patients, and they saw many patients, and you didn't hear a peep out of anybody. They must have had the touch of God.
And they were so pleasant to work with. They were so cheerful all the time. Even after putting in what seemed, I don't know, like a 12-hour day, they came in as happy as can be. They were really a wonderful, joyful team.
And how long were they there? How many days were they there? Were you guys there, and how long were they there?
Our part of the clinic was open for 3 days, but they were for 4 days, because they did 3.5 basically at least.
Yeah.
So,
You know about how many patients that you guys saw? How many they saw?
We know total. We know it was 600 plus in the 3 days. And just to give you a picture of what that means, we had two providers. I'm a nurse practitioner, and Joyce is a physician. And Eileen was our light in everyone's eyes, because she made sure that everyone ended up in the place they needed to. We had a pharmacist, and we had somebody who did triage, and then we had 2 interpreters. It was 8 total people. It's not a big team.
Yeah.
And it was a perfect team.
Yeah.
So we saw, and we did glasses too.
Oh,
so
wow.
we saw 600 plus between the two groups. I don't know the breakdown of the numbers, but I know
I would guess that
hard.
they saw at least between 40 and 60 patients per day.
No, I think they saw 120 on that first day.
Did they?
Yes, that's what I had.
120 on the first day.
Yeah, so that tells you their pace. They were just doing and doing and doing.
And they were so organized. They were very good about, the people were lined up, and they would come and make contact with them and let them know when they're going to be coming in or whether they'd be able to be seen, that the people were patiently waiting, no angst. It was a very pleasant experience for everyone.
Great. Well, I want to thank you all. I appreciate it very much, and we'll share this with the Brandons, and we'll share this with others around. Thank you very much. I really appreciate it.
You're welcome.